So today we are going to talk about hysteroscopy. Hysteroscopy means visualization of the uterine cavity, endometrial cavity. That means we go inside the uterine cavity and see whether everything is normal inside the uterus or not. So hysteroscopy is a process where it is done through the vagina and cervix, and we use a very fine telescope. So there is no cut on the abdomen or no scar mark that is seen after hysteroscopy. So normally this is a daycare procedure where the procedure takes 15-20 minutes, and after 4-5 hours the patients are ready to be discharged from the hospital. And so we can do it under general anesthesia, complete anesthesia, but it's a low intensity, or we can do it without anesthesia also, which is called office hysteroscopy. So in office hysteroscopy, the patient walks into the hospital, we do the hysteroscopy and walks out within 10-15 minutes. So apparently it's a painless procedure. And so what are the conditions where we do hysteroscopy? There are many gynecological conditions where we would like to inspect the inside the uterine cavity to detect whether everything is normal or not. For example, somebody is having any abnormal uterine bleeding. Suppose during menses somebody is bleeding heavily, somebody is more than 35-40 years, and the lining on ultrasound it looks thicker. So that is an indication where we do hysteroscopy to see inside the cavity whether the lining looks healthy, whether there is any visible polyps, overgrowth of the lining. Then we cure then and there. So abnormal uterine bleeding or any disturbance in the menses can be an indication for hysteroscopy. Also, there are females who after their menopause they continue to bleed. That is called postmenopausal bleeding. So in postmenopausal bleeding, we would like to inspect the uterine cavity just to exclude that there is no pre-cancerous or cancerous conditions, because that age group is at a high risk of developing uterine cancer. So also there are other indications of hysteroscopies, like suppose somebody is not getting pregnant for a longer time and there is something not normal in the ultrasound in the lining. So that also is an indication to do the hysteroscopy and see the inside of the uterus, to look at the openings of both the fallopian tubes. So that gives a very clear and great idea about the inside of the lining where the baby stays. And there are rarely we do cases like suppose somebody is using a contraceptive device like copper T or Mirena, that is not, the thread is not seen, it is misplaced. That is also an indication where we would like to look inside the uterine cavity and see. Like I said, this is apparently a painless procedure, and normally we send the patient 4-5 hours after the procedure, and mild cramps and mild pains are sometimes expected for which painkillers are prescribed, and the patients actually can do every activities after the hysteroscopic surgery except physical contact. Otherwise you can this a painless procedure, you can do everything, you can resume your work in 2-3 days. So for any queries you can contact us in the following numbers. Thank you very much.